Hello, thank you for tuning in to our online feature presentation here at Naturopathic.com. Today's online feature presentation is going to be in regards to allergies and sensitivities, nothing to sneeze at. In today's presentation, I'm going to be going through some of the background information in regards to what an allergy is. I'm also going to offer some of the naturopathic therapeutics that is provided to help with these allergies and sensitivities. I'm also going to elaborate on one of the treatments that we do offer here at Naturopathic that is extremely beneficial for allergies and sensitivities, and not just for allergies and sensitivities, but it is an integral part of one of our treatment protocols that we do offer here at Naturopathic. And you'll have a better understanding as to why this is incorporated. You'll have an understanding as you go through this, our strategy as to why and how we approach this common symptom that we see with patients, specifically now getting into the whole spring period with a lot of our environmental allergens being presented to our patients. So let's go through with this. So what is an allergy? What's a sensitivity? Well, the definition from the immunobiology of the immune system in health and disease, and this is the textbook that I used when I was at the University of Toronto for immunology here. So an allergy or a hypersensitivity reactions are the inappropriate responses to harmless foreign substances. These harmful adaptive responses are identical to the responses of protective immunity that destroy pathogens. So what you're looking at here, it's an inappropriate response of the immune system, okay? And these responses are actually identical to the exact same response that is needed to help protect the body. That's the whole purpose of the immune system. So we'll elaborate on that as we go through this. An allergic reaction occurs when an already sensitized individual is re-exposed to the same allergen. Allergic responses range from the familiar runny nose, sneezing, itchy eyes seen in hay fever to the systemic anaphylaxis and death in response to a bee sting or an insect bite in a highly sensitized individual. And what we're seeing more and more now these days are anaphylaxis to peanuts. I mean, it is not uncommon now to see a lot of peanut-free substances that are out there because the growing population to peanut allergies is becoming bigger and bigger, and that is really interesting. Why is it that we're seeing more of that now, whereas 10 years ago it was relatively uncommon here? And so I want you to kind of focus in on that first point here. The allergic reaction occurs when an individual is already exposed. So for example, let's say, and we'll take peanut allergies as an example, a child gets exposed to peanuts, nothing happens, but there's an immune response that is occurring. And then a few days later, a few weeks later, a few months later, that same child who now has an allergy to peanuts, which is unbeknownst to anybody, consumes that same peanut, a peanut product, an allergic response occurs. So again, a reaction occurs when an already sensitized individual is re-exposed to the same allergen. These responses do not occur when an individual is first exposed to an allergen. We just talked about that. The initial adaptive response takes time and usually does not cause any symptoms. Once an antibody or a T cell that reacts with the allergens have been produced, any further exposure will produce symptoms. So what are we talking about here? Individual gets exposed. For some reason, the immune system recognizes that exposure as a threat, so it starts producing these antibodies. Now what ends up happening, that individual gets re-exposure, example again with the peanuts, or even those individuals who have environmental allergies. Well, geez, I didn't have it last year, what's going on? Well, it was that last year that you got that exposure. The immune system, for some reason, starts to recognize this as a threat and produces antibodies. And then you get re-exposure the next spring or the next consumption of the peanuts. And then T cells will then react with these allergens, the peanut, the ragweed, the pollen, the tree pollens. And what will happen, you will now start to develop a allergic reaction. These responses are identical to the response of a pathogen, But since the foreign substance itself is harmless, as in that foreign substance being the peanut, the ragweed, the tree pollen, the only pathology that is seen is that caused by the immune response itself. And that's a very important point here. The problem here is the immune system. So as you see, the allergic responses demonstrate that the immune response itself can cause significant pathology. Your immune system, unfortunately, at this point in time, is the culprit. And I think this is the key point that I really want to try to stress as we are talking about allergies and sensitivities. It's not the peanut that is the issue. It's not the ragweed that is the issue. It's not the dust mites. It's not the tree pollens. That is not the issue. The issue at this point in time is the immune response to that. That is the problem. See, for some reason, your immune system perceives that to be a threat. And because of that perception and the production of these antibodies, another exposure to those allergens are now going to create an allergic reaction, because now your body goes into defense mode. That substance gets in and goes, okay guys, let's go ahead and let's start attacking this, and by doing that, that is what creates the symptom. And that is a very important message that I always like to share with my patient here, that when you come in and you are suffering with these allergies, that fundamentally shares with me as your naturopathic doctor that there is something inherent deficient going on within your system. It is your actual immune system in and of itself that is causing the problems, and we need to now dig in and find out why this is happening. Hay fever. Hay fever is a typical allergic reaction. Okay, the initial exposure to inhaled pollen grains generate antibodies. You see, your body starts to produce these antibodies because it thinks it's a threat. When that same pollen is later inhaled, this leads to an allergic reaction. Specifically, an immunoglobulin E antibody response ensues after re-exposure. Boy, that's a mouthful, isn't it? What ends up happening is your body's going to produce a specific antibody within the family of immunoglobulin E. Now, what ends up happening, these immunoglobulin E, they kind of attach themselves to what we call mast cells. Okay, these are cells, and you know what, your antibody E's are going to kind of anchor themselves onto these mast cells, and these mast cells will line the respiratory system, the nasal passages, the throat, and that's the first entry point, right? When you're looking at any type of environmental allergy such as hay fever, you're going to be breathing that in. It's going to go through the nasal passages, and that's where all your mast cells are. When the allergen binds to the preformed antibodies on the mast cell, so remember, those antibodies are now hanging out and stuck onto these mast cells. You breathe that in, that allergen in, hay fever, ragweed, I should say, or any of these pollens. What ends up happening, that pollen then kind of sticks onto that antibody. That antibody which is stuck onto the mast cell. Now the mast cells are activated because of this exposure, because of this response, and it starts to release mediators within the immediate vicinity. Okay, now this is the same principle that is utilized for the skin prick test, right? Many of you allergy sufferers who've gone in to see their allergist have gotten the skin prick test, and you irritate the skin with a bit of a skin prick, and then there's dilutions of certain items that are then applied to that skin test in itself, or that aggravated skin tissue. With a local, this is the same principle for the skin prick test, where local administration of a small amount of allergen in the skin, which then therefore causes a wheal and flare reaction due to the local mast cell activation in the skin, and that's what is causing this reaction. So that's the same principle that's used. Now you think of it, this is on the skin in itself. The wheal and flare is also going to occur within the respiratory system when you get exposure to this, when you're breathing this in. So again, the initial response to the triggering of the mast cell is an immediate release of preformed mast cell granule content, and this is particularly histamine and various other enzymes. This is the major reason why antihistamines are used to help with the symptoms of allergies. Right? Antihistamines, what they do is, as an allergy sufferer, you get exposed to these pollens. It then therefore creates a reaction where the mast cell starts to spew out into the local area within the respiratory, the sinuses and the throat. the histamine contents. Histamine is going to cause a bit of a wheal and flare, so there's going to be local irritation and inflammation within that area. So what does an antihistamine do? It kind of gobbles up that histamine. By gobbling up or sponging up or pairing up and coupling to that histamine, it prevents the action of the histamine to take place, and thereby, by doing that, it reduces the symptom of the allergy sufferer. Repetitive stimulation of mast cells leads to an airway that is chronically inflamed and much more susceptible to other types of stimuli, such as changes in temperature or other airborne pollutants. So again, inherently, I mean, stressing the point that if the individuals coming in and have these allergies, we do know that their immune system is compromised. From my perspective, the next step is now to try to isolate and try to figure out what are these factors that are compromising the overall immune system. But because of that compromised immune system, that individual now is going to be more susceptible to other items. So for example, you will notice that, Johnny is suffering from allergies, but now he's got asthma and he's got chronic skin irritation and eczema, digestion is poor. So, the overall system is just not working well. And again, we'll get a bit more into the strategy as we get closer to the treatment options that we do have available here at Naturopathic. Moulds for a geographical area, and that area, again, mold exposure is very significant. Now, within this Niagara Peninsula, surrounded by lakes here, and with the moisture content, mold exposure is a very significant allergen, producing various allergy and sensitivity symptoms. Environmental mold is huge. If you have access to the weather network on the internet, what you will see during allergy season, they'll have a pollen index. And a lot of the time that I'll share with my patients is that every once in a while check that pollen index in relation to the city that they're living in. And if you scroll down that, they will also give you a spore content for specific molds, Cladosporium, Aspergillus. And molds are going to be huge. Molds are huge factors. Molds are also huge factors within the home environment. With these the newer homes that are now being built, they being so energy efficient and being airtight, there are a lot of issues that can occur due to molds, and molds is a huge factor to have an impact on compromising the immune system. So what are the type of allergens that we deal with here? Let's see here. We've got inhalants, perfume, formaldehydes, chemicals. How many? I have many patients that I see that are coming in with what we call multiple chemical sensitivities. Certain questions that I like to ask my patients. When you walk down the perfume section of a department store, does it trigger anything? Do you get migraines? Do you feel nauseous? Aside from the pricing of it, that is, the smell of these odors. I mean, if you go down the whole laundry detergent aisle in your local grocery store, what kind of symptoms are you developing here? So, I mean, you're going to see this more and more with these multiple chemical sensitivity individuals who are coming in. They can't stand any strong perfumes, and in fact, a lot of your medical offices now request specifically from that you as a patient refrain from using any type of perfumes or any type of deodorants for the respective other patients who have a lot of these sensitivities. There are ingestant allergens, food allergies, right? You're looking at certain type of vitamins and minerals. Some patients can't take supplements. So again, these are allergens that individuals are coming in to see me about. Hey, Dr. I can't eat anything. Whenever I eat certain foods, I get this response. I feel horrible. I get bloating, get low energy, or I've taken all these multivitamins, and every time I do, and these supplements, I just feel horrible. I get these reactions. So these are other allergens too, and here we are trying to help with supporting the immune system, and some of the supplementations that is being suggested is actually triggering these allergic reactions because they have an allergy to it. Your common contactants such as your poison ivy, you got certain infectants such as microorganisms, dental amalgams. The way that they can cause and create some allergies is an aspect of suppressing or impacting your immune system in a deleterious way, and then therefore increasing your susceptibility of developing allergies. And physical changes, environmental atmospheric changes, right? Why is it that, individuals who are suffering with headaches, they can predict the weather? Oh my goodness, it's going to rain tomorrow. I know because of the fact that I'm getting a headache right now. So these are various forms of allergens and allergies. So what else can cause allergies and sensitivities? Emotional factors, chemical factors, infections. Detox pathways that are not working properly, illnesses or chronic diseases. I guess the fundamental point, which I've been trying to stress right now, it really makes no difference what the individual is allergic to. The key component that we need to focus in on is questioning why is the immune system responding in such a way that is actually creating the problem here, whether it be eggs, whether it be peanuts, whether it be perfume. And these are the things that we need to question. Now, there's so many factors that we can look at, so many factors that are filling up that individual's cup. Now, are we getting these issues because the individuals have chronic toxicity? Maybe they work in a polluted environment, getting exposure to pesticides, such as your farmers. Maybe they do have a mouthful of amalgams that then therefore have an impact on their overall immunity, therefore creating the susceptibility. Our question that we're looking at right now is not the allergen. Our question and the answer that we're trying to look for at this point in time is what are the causal factors that is impacting the immune system in a deleterious way? What are these factors here? And that's the approach that we want to look at from a naturopathic perspective. That's the approach that we want to look at from a naturopathetic perspective. What are these factors here? Are we looking at the fact that that individual has detoxification pathways that are not working optimally? And I'm not talking about disease here, and I'm not talking about the fact that the liver is damaged. We're looking at from a functional perspective. Many of you patients, or many of you individuals who are tuning into this online feature presentation, I'm sure many of you have gone into your doctor and say, hey, you know what, I know I'm allergic, or I don't do well with breads or gluten. Test me for celiac. The test comes back, the doctor looks at the test results, and it says negative. Looks at the patient, you're perfectly fine. Meanwhile, that patient is doubled over in the waiting room because they just finished and polished off a Subway sandwich, and with all the wheat and the bread, and all of a sudden, they're getting these cramps. See, we're looking at it also from a functional perspective. Maybe it's not overt enough to create a disease. However, functionally and fundamentally, there is something going on. The patient is not feeling well. So are you going to sit there and say, well, look at the piece of paper and share with the patient that there is no problem? Meanwhile, you can see exactly that there is definitely a problem. So what we need to take a look at is what's going on from a functional perspective. What we need to do is make sure that everything's working efficiently. What we need to do is to start to focus on what are these factors here that are compromising the system in itself, therefore not allowing the system to work optimally, and because of that, symptomatically, they're developing these allergies. So that's the first question, and then you start working your way down. So from a naturopathic perspective, what we want to do is we look at it on a three-stage series here, and that's how I like to implement. And the first stage that we want to look at is implementing a solid foundation. We need home base to work from. That foundation is going to be based upon what's going on structurally, how are things working, and we're not talking about disease, we're talking about from a functional perspective. Are the organs of elimination working efficiently? Do we have good working organs from a detoxification perspective? And there are clues that we can get by asking certain questions. Such as, hey, are you getting any type of reaction when you get exposed to perfume? When you drink a cup of coffee in the morning, do you notice that you still have that coffee buzz and it's like 11 o'clock at night? Do you have a specific odor whenever you eat asparagus? Like, these are all functional tests that will indicate to me whether or not the individual is quote-unquote detoxing appropriately. So let's get that working better. Then the second factor that we want to take a look at within this first phase of the foundation is what's going on from a nutritional perspective. Like, are you eating junk? If you're eating junk, then maybe that in and of itself is compromising the immune system, and therefore that is why the immune system is not working effectively and efficiently, hence presenting itself with these allergies. You are eating effectively, you are eating clean, you are eating as healthy as you can. And the next step that we need to take a look at is, are you getting the appropriate nutrients in? Why is the immune system working the way it is? Why is it creating the problems here? Well, is it because fundamentally you're just not providing the body with the appropriate and necessary nutrients that is needed to maintain optimal health? So these two major factors that we look at supporting what's going on structurally and ensuring the fact that the patient can absorb the nutrients by cleaning up the diet and enhancing absorption, this in and of itself creates the foundation on the basis of where we want to move forward with. You implement that foundation, then what you can start looking at is phase 2. And then phase 2, what we start looking at within this overall strategic therapy sessions that we want to move forward with, you start looking at what are the external factors. Then you start to question, why was the overall system compromised to begin with? Are there emotional factors? Are there hormonal factors? Are there environmental factors? And these are the things that you want to start slowly checking off to see what are these factors that are filling up the individual's cup. Once those are identified, then you move on to phase 3, and the phase 3 is to specifically target these and remove it from the system. Environmental factors, we can start looking at doing some detoxification factors and what we can do to try to remove the overall burden. So this is kind of the framework that I work with and I move towards with my patients, and specifically with my patients who are coming in with allergies. What are other allergens? Well, genetic factors, my mother, my father, and so forth. But, that's not written in stone. Maybe there's other factors that may be contributing to that because everyone eats the same. Maybe poor dietary habits and so forth. Mold and fungi, stress, organs, hormones, and glands. So these are other things that can cause allergies and sensitivities. Now, the type of testings that are available, you have self-assessment questionnaires. You got that scratch test, skin prick test. You got the RAS test. There's pulse testing also, muscle response testing, and electronic testing in AccuBase. And there's also some other testing that is available specifically, utilizing and sending blood samples, which can be tested also in regards to the immunological response to certain allergens and certain foods. Various treatments used for allergies and sensitivities. You got medication, antihistamines, steroids, adrenaline shots, allergy shots, more from a naturopathic perspective, rotation and elimination diets, certain homeopathics, enzymes, potentiated desensitization, acupuncture, emergency treatment, and E.A.Ts. That's something that we specifically utilize here at Naturopathic, and again, not solely just for allergies and sensitivities. It is an integral part of the treatment protocols that we offer here at the clinic. So conventional treatments, Lippincotts, pharmacology. The key to conventional treatment is the destruction of histamines. Allergic reactions are often treated with antihistamine drugs. However, the chronically inflamed airway is not significantly affected by antihistamines. What you'll notice, and what I've noticed with my patients coming in, on the majority of the time, naturopathic doctors aren't necessarily the first treatment option or the first option that a patient will look at. So most of the times, the patients that we are seeing, everything else has failed. They've seen their allergist, or they've seen their medical doctor, they've seen specialist after specialist, and no one can really come to the bottom or give them and offer any type of solutions. And that's when they're usually strolling into our clinic here. And the typical things that I'll see is, hey, Dr. Ram, I've been suffering with these allergies for the past 10 to 15 years. Hey, in the beginning, everything was great. Just took an over-the-counter antihistamine and it worked. And the second year, that didn't work, so I took the extra strength. Third year, extra strength didn't work, so I'm doubling up on things. Then I finally see my allergist. Go to see the allergist, skin prick test. Two things would happen. Number one, I'm allergic to everything, or the other patient is, I'm allergic to nothing, but here I am having all these symptoms like an allergy sufferer. Some of them then therefore will go on to get allergy shots. And again, they're coming to the clinic here, and hey, I've been doing the allergy shots, and you know what, things aren't getting any better. So this is the type of patients that we are seeing here. They've been on the Allegra, they've been on the Claritin, the Saldane, etc. So all of these medications are antihistamines, and they're used for symptomatic relief. Hey, look, you know what? If it helps, great, use that, but it's not going to cure it, And again, if you're coming in to see me, obviously it's not working. Hey, with some of my patients, some of my chronic severe allergy patients, you know what? All they need to do is take one Allegra, one of the Claritin, Whereas before they had to take 4 to 5 of them. Hey, I'm happy with that. If they're only doing that maybe once or twice a week for a few months out of the year, I'm happy with that. Obviously I'd like to get them off of all type of medication itself. But again, I mean, this is what we're looking at. When these drugs offer no relief, that's when you're looking at corticosteroids. You're looking at inhalers, you're looking at nasal sprays. But again, we are only looking at, when you're looking at from this perspective of symptomatic relief. I know that's important and I have no problems with that, but it's not going to cure. Some adverse effects observed with antihistamines are drowsiness, fatigue, tremors, vertigo, drying of the nasal passages. So again, naturopathic treatments. In naturopathic medicine, we treat the underlying cause of the disease. And at this point in time, the symptom or the issue is allergies. As I have stressed throughout these slides here, that is a direct reflection that the immune system is not running on all cylinders. The immune system is compromised. So then the question that we start to look at is, why is it? What are these factors? And the strategy that we utilize here is a 3-step process, 3-phase process. Step 1, implement the foundation. What is the foundation? Well, support what's going on with the overall system. Number 2, take a look at what's going on from a nutritional perspective. These 2 points will encompass the foundation. Give the body the support that it needs to do the job that it needs to do. Give the body the nutrients and the fuel that it needs to accomplish this task. That's the first phase. Implement that. What are we trying to do? Just give the body some support. The second stage, then try to identify what are the other potential factors that maybe have compromised the system to begin with. Are they hormonal? Are they emotional? Are we looking at environmental exposures? So these are the things that we start to question. Once we identify that, we move on to stage 3, and then stage 3 is to specifically remove them and pluck them out of the system, isolating those factors, removing them. And in essence, what we're trying to do is give the body an unburdened scenario here where it can go ahead and accomplish optimal health and the task that it needs to do. So with that in mind, that's how we move forward. So, I have patients coming in who goes, doctor, I have issues with peanuts. Just treat me for the peanuts. Well, it's not the peanuts. Peanuts is not the issue here. The issue is what's going on with your immune system. Why are you responding? So let's take a look at some of the things that we offer. One reason for allergic reactions such as hay fever is due to the instability of the mast cell releasing histamines. This may be due to subclinical vitamin and mineral deficiencies. So maybe that's the reason. Maybe that's why that individual has susceptibility to the ragweed, and therefore, because of that, the mast cells are unstable and releases the histamine. The histamine creates this response. So subclinical means that it's above the threshold of obvious disease, but not deficient enough to cause evident vitamin and mineral deficiencies. So some of the useful vitamins and minerals that can be utilized: niacin, B3, pantothenic acid, B5, B12, magnesium, vitamin C. And I haven't given dosages here because we're just offering suggestions of what we do, but each of the dosage would be unique for the individual who is coming in for the symptom in itself. So these are certain things. So, a good multivitamin, let's make sure that you can get these nutrients. And maybe that is why. Maybe that is why the immune system is a little compromised, creating these allergies, because we're not getting these appropriate nutrients into the system. Maybe the diet isn't good. Maybe they're not taking a multivitamin. These are some of the things that we can start to question and start to answer immediately as we move forward with. There's certain herbs that we can use. We can definitely go ahead and take a look at some of the Hydraceus canadensis, that's golden seal, urtica, that's nettle, euphrasia, eyebright. These are certain herbs that can definitely be utilized to help support the system, to help with the allergies in itself. What I don't want to come across here, I don't want to chase these symptoms with supplements. Right? I don't want the patient walking in and they have these symptoms and they walk out with a garbage bag full of supplements. Then there is no difference. There is no difference than what I would be doing than what your medical doctor would be doing by offering you those antihistamines. I'd just be offering you a natural version of that. So fundamentally, what's the difference of our approach here? Now, albeit if we have to make a choice between a pharmaceutical and we can get by with the supplementation, then yeah, I'm all for that. But I think fundamentally we're still not getting to the cause of it. Let's just make sure fundamentally that, you know what, yeah, we can aid in the symptoms. We definitely want to help with the symptoms, but we also want to ensure the fact that these symptoms don't come back. And the only way that they won't come back if the overall system and the health is optimal. If we can attain that, then we shouldn't have these issues with these symptoms. Some homeopathics that can also be used is arsenicum, euphrasia, pulsatilla, nux sulfur, allium cepa. And again, I do not want to use it a cookbook approach. I don't want a patient thinking that they can walk out of there and just get all these homeopathics and see if it's going to help and treat their symptom. These are certain things that can be utilized to help within the aid, but again, it's a combination of what's going on from a nutritional perspective, from a botanical perspective, a supplementation perspective, and these are some of the things that we can look at. Diet is a key thing, you know. In my perspective, I want the food to be medicine. Right? Prospective studies have shown a higher incidence of allergy in early childhood among children who have low populations of lactobacilli and bifidobacteria. That's your probiotic, your acidophilus. Evidence suggests that supplementing the diet with probiotic lactic acid bacteria may inhibit allergic development and symptoms here. So, what you want to also look at is these probiotics are definitely within the GI system. So the GI system, the gut, is going to be an integral part of treatment here. We need to make sure that the GI system, the gut, so to speak, is being supported so that we can try to attain optimal health, and by attaining optimal health, reduce the overall symptoms of what the patient is walking in with. Now, what are some of the things that can reduce lactobacilli or these probiotics? Overuse of antibiotics, right? Overuse of antibiotics at an early age can definitely create an imbalance within the GI system in itself, and that can then therefore increase the susceptibility of that patient being compromised and then therefore developing allergies. I mean, how many times have I heard my little son, yeah, by the time he was 3 years of age, he had chronic ear infections, he was on all these antibiotics, and he had tubes in the ears, and so on and so forth, and here that child is seeing me 4 or 5 years later, 10 years of age, chronic allergies, skin issues, and so forth. Yeah, well, fundamentally, one of the things that I've got to look at is, okay, what's going on from an overall foundational perspective, and let's make sure we ensure that we get support with the GI system, supplement them with some good acidophilus, make sure we clean up the diet, and that in and of itself can definitely help improve the symptoms, and it's with food, right? Fatty acid, essential fatty acids. A typical Western diet contains almost 10 times more linolenic acid than alpha-linolenic acid, causing an imbalance here. Okay, so again, the type of essential fatty acids, your omega-3s and your omega-6s, you're kind of bouncing that back and forth here. You want to predominantly start looking at supplementing with an omega-3, a good fish oil. This is what we want. We want more of a balance of your omega-3s here. This imbalance results in an altering of the balance of T helper cells, type 1 and type 2. Favoring the production of immunoglobulin E, remember the first few slides here, and causing sensitivities and allergic reactions. So, a deciphering of that second point. When you don't have a good balance of your essential fatty acids, what can happen, your immune system can start to tip in the favor of creating more of an allergic reaction. Okay? By doing that, it increases the individual's susceptibility of getting allergies here. So again, you know, most of the Western diet is going to contain more of your linoleic acid here, and therefore, because of that imbalance or the imbalance of the fats, what can happen, and therefore it can start to create an imbalance within your T helper cells or part of your immune system, which then therefore increases the susceptibility of producing this immunoglobulin E's for specific allergens, creating your allergies. Eliminate allergy technique, E.A.T. So this is an integral protocol that we utilize, a treatment protocol that we utilize here at Naturopathic. And the whole purpose of what the E.A.Ts are is to enhance the body's ability of absorbing nutrients, right? So, you know, the first step is let's clean up the diet. Let's get rid of the junk. Let's make sure we get a good balance of your essential fatty acids. Let's make sure you're getting the nutrients from the foods and good quality foods here. Then the second step, you want to make sure, if you're making these changes, let's make sure you can actually absorb those nutrients efficiently and effectively here. And This is the technique that we utilize, eliminate allergy technique, specifically to enhance nutrient absorption. And I'm not saying you're completely deficient. We're looking at enhancing the absorption of it from the diet and the foods that you eat, and even from the multivitamins that you're taking. Eliminate allergy technique. It's used to help alleviate the possible causes of allergies and or sensitivities, emotional, chemical, infection, detox pathways, body overload, illness, and chronic diseases related to allergies or sensitivities. What we're trying to do is provide the body with the material that it needs to accomplish its task through the nutrients from the foods that you eat and the supplements that you take. How does eliminate allergy technique work? Based on Chinese medicine. Chinese medicine is based upon your autonomic nervous system, your qi, electromagnetic field. What you're looking at is that overall qi, or the innate system within the body, the autonomic nervous system, and we're trying to tap into that. So what happens during E.A.T treatment? Number one, we want to strengthen the weak organs. Number two, challenge or take a look in regards to the allergy or sensitivities. We want to reset the overall body's reaction to the allergies. We manipulate acupuncture points. We retest the allergen that the individual has been holding on to. We give a homeopathic, and we request and suggest that the patient take that homeopathic for that specific allergen for about 3 days and 3 times a day. It's based on Chinese medicine. We're looking at more or less trying to rewire the overall system such that the body can start to adaptively absorb these nutrients from the foods that you're eating. And this is what occurs during an E.A.T treatment. What are some of the basics here? The basics that we look at are proteins, neurotransmitters, certain minerals, calcium, iron, vitamin C, your B complexes, your sugar metabolism, fat metabolism, fat-soluble vitamins, A, D, E, and K. What we're looking at here is ensuring the fact that the body gets the basic nutrients. And what are they? Proteins, water-soluble vitamins, fat-soluble vitamins, minerals. These are the things that we want to ensure. And then by providing the body with these necessary nutrients, what we're trying to do is establish balance. So if a patient comes in and they have an allergy to peanuts, they have an allergy to ragweed, we don't treat them for the peanut or the ragweed right away, because what we're trying to do is share with the patient we want to stabilize the immune system, because it's the immune system that is creating the problem. If we provide the body with the appropriate nutrients such as your proteins, your minerals, your water-soluble and your fat-soluble vitamins, the majority of the time by doing that, supporting their overall structure, that will take care of the allergy, because the immune system is being supported. So then therefore when they get that exposure, whether it be the peanut, the ragweed, well, the immune system doesn't go haywire. It recognizes it, that it's not a threat, so to speak, and by doing that, it doesn't provide and produce this response. So stop your suffering and start enjoying life again. I hope by going through this online feature presentation, you have been able to have an understanding in regards to our approach. Understand that the allergy in and of itself is just a symptom, and it's a reflection of the overall system. And what we want to try to do here at Naturopathic is try to correct the overall system, try to attain optimal health, and by doing so, we can then therefore definitely help ease in regards to what's happening from a symptomatic perspective. I hope the viewers have been able to understand that the allergy is more or less a reflection that the immune system is not balanced. And I hope the individuals who have been tuning in have been able to realize that some of the therapeutics that we do utilize. Now, the key thing, and I want to ensure that this is something that can definitely be supported and treated. And I thank everyone for tuning in and going through with me on this online feature presentation. Take a look at our website. We've got a lot of things that we also always add on. Take a look at Nat News. That's our online newsletter that we do give to our to subscribers who sign in. So take a look. We're always trying to add new things, and any type of feedback would be greatly appreciated. And I look forward to going through with you through another online feature presentation. Until then, you take care.